Okay. Hi, everybody. It's Alexander Grichuhin with HRN, of course, also known as AKA Home Rehab Network. So today we're going to be going over some of the tips and tricks with pulmonary rehabilitation, lung and heart, cardiopulmonary rehabilitation. I'm Alexander Grichuhin. I'm one of the designated pulmonary care practitioners in with HRN that handles the advanced lung and heart disease. So today we're going to be going over just a few things as far as like disease education and some of the other helpful tips and tricks. First, there's a couple of questions on here, and if anybody has questions on the while you're watching, you can easily submit a comment on the comment section of your video of what you're watching, and I will read it and try to answer those questions. Anything to deal with pulmonary and cardiac rehabilitation, go over exercises, stuff like that. Okay, so if you have any questions, please write in the comment section and I can see them right as soon as they come in. All right. So first off, this is, well, there's a lot of good questions. One of the questions is like, what are the best exercises when suffering from COPD? How can I be more active and motivated? How can I get more energy? Are your therapy classes at a specific time and days? So there's a lot of good questions on here, which I'll be happy to answer. One thing I want to go over is with pulmonary hypertension. Sorry, I'm grabbing the wrong thing. So we find this being a very common disease. You know, I mean, it's actually fairly common. So has anybody ever heard of the term or the term cor pulmonale? It's spelt like this. Okay, cor pulmonale. So that means right-sided heart failure. It's not a complete heart failure, it's the right-sided heart failure. What we look at with pulmonary hypertension, so let me kind of read off of the description of pulmonary hypertension, and then also let me give my point of view. Now, mind you, I go off of scientific facts, studies, things like that. I can't make anything up. So anything that I have obtained through the education, through schooling and stuff like that, and of course research is all I will be talking about. If I don't know something, I'm obviously going to just go to somebody who knows more on that specific subject. Okay, so if you heard something different, I'm not sure what to tell you besides maybe the education that you got wasn't up to par. And I kind of went through a lot of education with schooling, going to many schools, different other diversities, and ascertaining as much knowledge as I can to help my patients out. So I'll go to conferences, I'll talk to all sorts of various doctors and clinicians, exercise physicists, and things like that. So if I don't know something, like I said, if I don't know something, I'm not going to guess. I'm going to just give you scientific fact off of what we know so far. Okay? All right, so pulmonary hypertension. Pulmonary hypertension is the type of blood pressure that affects the arteries in the lungs and the right side of the heart. In one form of pulmonary hypertension called pulmonary arterial hypertension, PAH, blood vessels in the lungs are narrow, blocked, or destroyed. The damage slows blood flow through the lungs and blood pressure in the lung artery rises. The heart must work harder to pump blood through the lungs. So in the lungs itself, the pink stuff that makes up the most of the tissue of the lungs is called parenchyma. So, or lung parenchyma. It's the pink, squishy tissue. The fiber that makes up the lung parenchyma is a fiber called elasticin. Okay, so elasticin helps the lungs become very compliant, very easy to open up, and to, relying on elasticity to come back on exhale. All right, so with pulmonary hypertension, how they usually do it is they'll do a procedure where they actually put a catheter in your right heart. Okay, now they can do it two ways. They can go up to your leg, or just go right where there's big, huge veins coming in, like right here, and they'll actually insert a very small catheter to follow and go into the atrium, into the ventricles, and do a wedge-shaped basically it's a small little pilot. That pilot just means like a little balloon that fills up with air, and then they'll measure the pressure inside that artery. Okay, and that will determine, pulmonary arterial pressures. If it's very high, if it's like, usually it's about 15 to 24, if it's very high, good morning, if it's very high, then obviously that person has pulmonary hypertension. There are different various degrees of pulmonary hypertension, but when somebody has pulmonary hypertension, they find it more difficult to breathe because gas exchange is a little tougher. The heart works harder. If it goes on, well, let me kind of read on here, just so you can understand the knowledge base, as well as a more of an easier way to understand that type of lung disease, and technically heart disease. The extra effort eventually causes the heart muscle to become weak and fail, and of course called cor pulmonale. Cor pulmonale is right-sided heart failure. In some people, pulmonary hypertension slowly gets worse and can be life-threatening. Although there is no cure for some types of pulmonary hypertension, treatment can help reduce symptoms and improve quality of life. So, symptoms. The signs and symptoms of pulmonary hypertension develop slowly. You may not notice them for several months or years. Symptoms get worse as the disease progresses. So, mind you, this is a progressive disease, right? Do we wait till the last minute to seek help? No, of course not, because then you're at death's end. You're at the point of no return. Remember I brought that up with the exacerbation mom last time? You're at the point of no return. Why would you wait on a progressive disease? It's progressing. It's just going to get worse. You wait till the last minute, there probably won't be any help for you. Just like with COPD, it's a progressive disease. You keep waiting, and you keep saying, oh, there's all these million things I have to do. I don't have time for pulmonary rehabilitation. It's a progressive disease. If you wait till the last minute, you're lucky, but if you wait till the last minute and you survive it, you're just a very lucky person, okay? And it doesn't matter how much luck you feel like you have, luck runs out, okay? You're talking about progressive diseases. Any types of progressive diseases progress. They get worse. And if somebody, let's say, it's easier to rehabilitate somebody when they start having these complications, they have the diagnosis, but they're not knocking on death's door, okay? It's a lot easier to rehabilitate somebody when they're early in versus at near death. Somebody waits till near death because there's a million reasons not to do something, and they're always making up excuses. Oh, I have this, I have bills, oh, I can't afford it. I said it's covered by insurance. You don't have to afford anything. It's covered by your insurance company. In-state, in Maryland, Medicaid covers it. Then you have people that always have other people over, like construction crews or people that have family over. They just feel like they don't have the time. And then you have the people that just wait to the very last minute, that procrastinate, and they're wondering why they go back and forth to the hospital, why it's getting worse and worse and worse. It goes without saying it's progressive disease. If you wait till the last minute, you're not going to get a lot of help. Okay, everybody who waits, like let's say somebody's bleeding out. Okay, just God forbid, but let's just say that's happening. Somebody's bleeding out and they wait till the last minute. It's death. The last minute is death. It's not. I'm not trying to laugh at this situation, but it's, when you have a progressive disease, you never wait till the last minute. There's always going to be a million reasons not to do something. There's always going to be a million reasons. Oh, my kid is sick, my family's sick, I have to, help them out, and the holiday season, I'll wait for the holiday season. Oh, my birthday's coming up, I'll wait after my birthday. Oh, I have this surgery, chest thoracic surgery, and that's what's bothering me, is people have these chest or thoracic surgeries, and they want to wait until they don't feel anything anymore until they seek help. Think about that. According to protocol, according to the American Chest Physician Guidelines, you know, according to protocol, anybody who goes through any type of abdominal or thoracic surgeries should be doing respiratory exercises before and after. Okay, not waiting till the last minute. You know, and you have people that have thoracic surgeries, they have, you know, heart surgery or something where anywhere they have to open up the chest, you know, or they have abdominal surgeries. If you're not breathing, you're dead, right? I mean, that's the way it is. So imagine having all those complications just perpetuate and build up on its symptoms, and it's just at, you know, the worst thing you could do is, I'm trying to say is the worst thing you could do is just wait till the last minute. You join in as soon as you can to go into pulmonary rehab. So symptoms, signs and symptoms of pulmonary rehabilitation, pulmonary hypertension develop slowly. You may not notice them for several months or years. Symptoms get worse as the disease progresses. Signs and symptoms include blue lips and skin, called cyanosis, of course, chest pressure or pain, dizziness or fainting spells, called syncope, fast pulse or pounding heartbeat. That's when you have a lot of palpitations, you know, palpitations where your heart feels like it's fluttering. It's not beating as properly. It just feels like it's skipping a beat. Fatigue, shortness of breath, also known as dyspnea, usually while exercising and eventually while at rest. Let me repeat that. Short of breath, initially while exercising, meaning the people that have, you know, the first onset of, or the first degree of pulmonary hypertension, they will only get really, really winded, like really, really winded when they exercise. Okay, but then it'll slowly progress where now they're out of breath just by resting, like sitting down doing nothing, and they're completely out of breath. Swelling, edema, also known as edema, in the ankles, legs, and eventually in the belly area, of course known as the abdominals. Causes. What causes pulmonary hypertension? That's a great question. And like I said, I'm going off of this first, and I'm going to give you an easy explanation, okay, just to make it easier to understand, because a lot of times there's a lot of medical lingo that we just don't understand very well. You know, I have COVID. What can I do to help myself? My doing RMTs. Does the COVID damage lungs like pneumonia? I'll go over that in just a second. No worries. I'll go over that in just a second. So causes for pulmonary hypertension. Causes, the typical heart has two upper chambers, atrials, and two lower chambers called ventricles. Each time blood passes through the heart, the lower right chamber, right ventricle, pumps blood through the large blood vessels or the pulmonary artery. In the lungs, blood releases carbon dioxide and picks up oxygen. The blood typically flows easily through the blood vessels in the lungs. Pulmonary arteries, capillaries and veins to the left side of the heart. However, changes in the cells that line the pulmonary arteries can cause the walls of the arteries to become stiff, swollen, and thick. All right, so if you ever heard of the term arterial stenosis, that's the stiffening. Arteriomegalia, that's where the enlargement is. So if you ever heard about those terms, that's what this is kind of going off of. These changes may slow down or block blood flow through the lungs, causing pulmonary hypertension. Pulmonary hypertension is classified into 5 groups, depending on the cause. We have group 1, which is pulmonary arterial hypertension, also known as PAH. Causes include unknown cause, idiopathic pulmonary arterial hypertension, changes in gene passed down through families, that's hereditary, of course, use of certain drugs or illegal substances, heart problems present at birth, other conditions such as HIV infections, chronic liver disease, and connective tissue disorder like lupus. Okay, the group 2, pulmonary hypertension by the left side of heart disease, of course. Left side of heart is the group 2, pulmonary hypertension caused by left-sided heart disease. Causes include left-sided heart valve disease, such as mitral valve or aortic valve disease. Failure of the lower left heart chamber or left ventricle. So any type of failure that would lead to the group 2 of pulmonary hypertension. Group 3, Pulmonary hypertension caused by lung disease. Does everybody understand? Pulmonary hypertension caused by lung disease. Causes include chronic obstructive pulmonary disease, or also known as COPD. Scarring of the tissues between the lungs and air sacs, pulmonary fibrosis. Obstructive sleep apnea. I'm going to say that one more time too. Obstructive sleep apnea. Long-term exposure to high altitudes in people who may have a higher risk of pulmonary hypertension. Okay, so now we have the group 4, pulmonary hypertension caused by chronic blood clots. Causes include chronic blood clots in the lungs, or also known as pulmonary emboli, and other clotting disorders. Group 5, pulmonary hypertension triggered by other health conditions. Causes include blood disorders, including polycythemia vera, and essential thrombocythemia, inflammatory disorders such as sarcoidosis and vasculitis, metabolic disorders including glycogen storage disease, kidney disease, and tumors pressing against the pulmonary arteries. So anytime you have any types of pressures that's hitting against the pulmonary arteries, sometimes it can cause the arterial walls to thicken up. You know, the body likes to protect itself, and sometimes that's one of the best things it can do. But the only thing is that there's always cause and effect, meaning you have your body is trying to fix the lungs that was all damaged up by scarring it, right? Because now it's fixing it. So, or else there wouldn't be any scarring if your lungs didn't heal. So anyways, so you have all this scarring. So the body's trying to fix that problem. Now you have the aftermath of all the scarring, which is tight chest, right? Where it's hard to breathe. It feels like there's an elephant on my chest as I breathe. Very tough to breathe. And of course, the best action on this, let's see if it actually goes over any of the treatments. I'm just curious if it actually goes over any of the treatments here. Okay, complications. Well, there has to be. I know there's treatments. So treatments on pulmonary hypertension is, you know, the proper use of certain medications, but and that's what they usual go-to for. But this is off of the Mayo Clinic. Okay. For pulmonary hypertension, there's not a lot of information on the treatments besides a lot of medications. But, and you're talking about progressive disease. So the treatments can be very limited, of course, but the one thing that we do on our end for pulmonary rehab, how we help people with pulmonary hypertension, is kind of stretching out, making the arteries more compliant, because where is the arteries located? Lungs. So if you're stretching out the lungs, then it has no choice but to kind of stretch out a little bit, you know, in a safe way, but decrease the blood pressure, systolic and diastolic, in the pulmonary arteries itself by doing hyperinflation therapy and respiratory muscle training. So usually when somebody's in the program and they're doing respiratory muscle training, it usually resolves a lot of issues, from pulmonary hypertension, heart disease, and all. It usually solves a lot of these issues. But if the disease of a certain disease gets really, really bad, and even though you're working on, let's say, exercise for your lungs, you still might have a little bit of aftermath of the residual complications. Like your pulmonary arteries are looking good, or your heart's looking a lot better, ejection fraction's working well, in your heart, ejection fraction. Anyways, as you do proper rehabilitation, you should see those things go into a better normal instead of staying up very high or very low, of course. So we always want to treat the underlying disease on anything, but hyperinflation therapy is one of the biggest therapies that we do here, and that's with people with COVID. So let me answer this question up here. It says, I have COVID. What can I do to help myself? I'm doing the RMTs. Does COVID damage lungs like pneumonia? So it can, okay, it can. It's because it is an infection, but it's more of it's a pathogen in a sense that's causing it, because it's a virus. Well, anytime there's any damage in your lungs, especially like long-term COVID, you might have a lot of residual complications left over that will extend for a little bit more time. So let me write it up like this. Okay, so let's say you have COVID, and let's say it's COVID pneumonia, okay? So you have COVID, and I'll put a P right above that. So you're looking at these phases. All right, so I have COVID, then I have post-COVID, and then of course I have my recovery. So let's say I'm doing hyperinflation therapy, I'm doing respiratory muscle training, okay? And my symptoms I'll have a chronic cough that just doesn't want to quit sometimes. Remember, COVID symptoms are different for each person, but they're pretty much almost nearly identical, but they're still very different, okay? So let's say symptoms for COVID, I have an increased production of congestion. I also have tight chestedness, my chest feels very tight. Increased work of breathing. So my chest feels tight, why? Because all the scarring is coming into place, okay? And my work of breathing gets really, really bad when I walk. Let's say my work of breathing gets really, really bad when I walk for at least 2 minutes, okay? So after 2 minutes, the person is huffing and puffing, right? I'll have an increase in heart rate, chest tightness. So let's just use that for right now. The next phase in, the person can have a little bit of congestion now. So there's still some residual. And then on recovery, they might have very, very minimal, where they're barely feeling it. So that's that. After a while, so we got it to a point where your congestion is not as high, it's not being produced as much. And then on the recovery side, look at this as months, okay? So you first got COVID, you're doing respiratory muscle training. First month, when you first started rehabilitation, you have a lot of congestion. When you first came in, your chest feels very tight. These are the symptoms that you had when you came in or did pulmonary rehabilitation. You had an increased work of breathing where you're only walking for about 2 minutes before you have to stop. Maybe even sometimes it's a lot less than that too. I had somebody who had COVID, and they got put on the news because of the recovery. This is when COVID first happened, So I worked with this patient. He was very young. He was only around 50s. He was very young. Well, anyways, he was a very athletic person. When he got COVID, he was only able to go up five steps on a staircase before he had to stop. He couldn't walk very far. He had this super violent cough, and it just hit him every single time he breathed. So anyway, so I got chest tightness here. I'm doing respiratory muscle training. The second month in, chest tightness is not as severe. Okay, work of breathing. So now before the person was only able to walk 2 minutes, and now their 6-minute walk test was finally completed with being able to walk for at least 6+ minutes. Okay, heart rate, you still have an increase in heart rate. And then let's say the third month in, of course, you understand that what the trend is. Third month in, you remember, the first month you had chest tightness. On the second month, it's a little less, It's less than what it was when it started out. And on recovery, you still have some residual chest tightness where it feels very little bit tight, but it's barely noticeable, okay? Work of breathing, I need to increase my I need to increase my distance. So I'm starting more cardio exercises. but I'm not where I'm at, let's say, after 3 months on recovery, after 3 months, the person should be able to do at least a few miles. And that's what we got from a lot of our patients, that when they first started, where they weren't able to do a lot. But after 3 months in, and this is specifically off COVID. Okay, this is kind of answering this question that's on the comment section. Thank you very much for the comment. I mean, the question. So on 3 months in, obviously it wouldn't be as worse as if you were in this zone here. Okay. So the symptoms of how I feel subjectively is all the symptoms from congestion, chest tightness, my work of breathing, my increased heart rate. You know, obviously on month 3, the person's walking further, oxygen levels, person, you know, if this person was on a supplemental oxygen, then they most likely will be weaned off of oxygen. That's usually what always happens, you know. So they'll be weaned off oxygen. They might have some very residual chest tightness. They might have some residual congestion that's alleviating, but it's barely hard to notice now. And then, of course, their distance on walking is going up to miles instead of a couple feet. Increase in heart rate, you might find about 6 months in sometimes that you still have that heart rate going up sometimes. That's going to happen, you know, as you get better and better and better, you know, after rehabilitation, as long as you're doing your proper amount of exercise for cardio, heart exercises, then it should be going back to a good normal, okay? I hate to say a new normal, but a normal nonetheless, where, you know, we have people like in this program that couldn't walk very far are actually doing these mini marathons and stuff out like that to, you know, for nonprofit organizations that they do like 5Ks and things like that. So we have people like that in here. Figure, I guess when people get their life back, they didn't realize how precious breathing actually was. You know, we take that for granted sometimes. We just don't realize that how great it feels to be able to breathe. And a lot of clinicians don't understand that because they don't go to that situation. They just look at some people like a textbook. Oh, that person has COPD, so we have to do this medication. But there's nothing being prophylactic. There's no, you know, sometimes there's no prophylactic response, meaning there's nothing looking at that person that has COPD 6 months into the future, you know. So it's what I call reactive therapy, where you react to the certain situation to fix the problem, but you're not thinking ahead. You know, so when I hire respiratory therapists, I make sure that they're not just reactive, but also preventative, all right, or another sense prophylactic, but preventative nonetheless. So you might have some residual, but it should be alleviated where you won't feel it as much. 3-4 months in, you might still have a little increase in your heart rate, but that'll get better in time. Okay. All right, there's something also that Dr. Shaw brought up with me that I did not know, okay? Like I say, when I don't know something, I will ask. So it was beet juice. The beet is a bulbous sweet root vegetable that most people either love or hate. It's not new on the block, but it's risen to superfoods status over the last decade or so. Research shows drinking beet juice, also known as beetroot juice, may benefit your health. Here's how. Helps lower blood pressure. Beet juice may help lower blood pressure. Research has found that people who drank 250 milliliters, or about 8.4 ounces of beet juice daily, lowered both systolic and diastolic pressures. Isn't that nice? The nitrates compound in beet juice that converts into nitric oxide in the blood helps widen and relax blood vessels, are thought to be the cause why the systolic and diastolic will actually come down a little bit. Mind you, if you have normal blood pressure, it won't lower it. You know, it's people that have high blood pressure. Improves exercise stamina. According to the small study in 2012, Drinking beet juice, I'm reading it verbatim, so if one of the grammars are incorrect, I'm just reading it verbatim. So I did not write this. Anyways, according to a small 12-20 study, drinking beet juice increases plasma nitrate levels and boosts physical performance. During the study, trained cyclists who drank 2 cups of beet juice daily improved their kilometer time trial by approximately 12 seconds. At the same time, they also reduced their maximum oxygen output, meaning you oxygenate a lot quicker. May also improve muscle power in people with heart failure. Results of a 2015 study suggest further benefits of nitrate in beet juice. The study showed that people with heart failure experienced a 13% increase in muscle power 2 hours after drinking beet juice. So that's actually really big. That's huge. 13% might not sound like a lot, but that's a percentage that you can notice. You know, like you might not notice 1 or 2%, you know, of an improvement, but you will notice a 13% improvement, especially drinking it 2 hours before your exercise. So it helps with oxygenation. These are things that I haven't researched, but Dr. Shaw researched it, and I didn't know about beet juice, so he filled me in, and then I did my own research on it, and it's actually pretty beneficial. According to a 2011 study, nitrate may help increase blood flow to the brain in older people and help slow cognitive decline. Does anybody know what type of decline that is? Dementia. So it can slow the progression of dementia. After participants consumed a high nitrate diet that included beet juice, their brain MRIs showed increased blood flow to the frontal lobes. The frontal lobes are associated with cognitive thinking and behavior. More studies are, of course, needed, but the potential of a high nitrate diet to help prevent or slow dementia is promising. That's really nice to know about that. Watch more in food benefits. Okay, another thing that beet juice will help with, helps you maintain a healthy weight. Straight beet juice is low in calories and has virtually no fat. It's a great option for your morning smoothie. I'll give you a nutrient and energy boost. They misspelled that. It should say, it'll give you a nutrient and energy boost as you start your day. Another sixth reason is may prevent cancer. Beets get their rich color from bellotins, which are water-soluble antioxidants. According to a 2016 study, I think I might be pronouncing that incorrectly. Betalains. Yeah, I'm correct. Betalains have chemopreventative abilities against some cancer cell lines. Betalains are thought to be free radical scavengers that help find and destroy unstable cells in the body. Now, mind you, more study is needed, but it's actually it's pretty promising, you know, pretty promising. Good source of potassium. Beets are also a good source of potassium, a mineral and electrolyte that helps nerves and muscles function properly. Drinking beet juice in moderation can help keep your potassium levels optimal. If potassium levels get too low, fatigue, weakness, and muscle cramps can occur. Low potassium or very low potassium may lead to a life-threatening abnormal heart rhythm. Let's see, a good source of other minerals. Your body can't function properly without essential minerals. Some minerals boost your immune system while others support healthy bones and teeth. So besides potassium, beet juice also provides iron, magnesium, sodium, zinc, copper, and selenium. It really actually has selenium in it? That's not bad. Okay, let's finish this up and I'll go over some questions if you have any questions on these. Good source of folate. Folate is a B vitamin that helps prevent neural tube defects such as spinal bifida and ankylocephalia. And so may also decrease your risk for having a premature baby. Beet juice is a good source of folate. If you're a childbearing age, adding folate to your diet can help you get the daily recommended amount of 600 micrograms. See, the 10th reason to have beet juice supports your liver. You may develop a condition also known as non-alcoholic fatty liver disease if your liver becomes overloaded due to the following factors: a poor diet, excessive alcohol consumption, exposure to toxic substances, and a sedentary lifestyle. Sedentary lifestyle, sitting down too much is not going to be good for anybody. Of course we know that. The antioxidant betaine also potentially helps prevent or reduce fatty deposits in the liver. Betaine may also help protect your liver from toxins. And of course, may also help reduce cholesterol. Now, there are some precautions. Your urine and stool may turn red or pinkish after eating beets. This condition, known as beeturia, is harmless. However, it may be startling if you don't expect it. That would be kind of startling if you woke up and, you're doing your morning BM and, it looks like blood's coming out of you. If you have low blood, it should never be that thick. It should not be that dark of a color. It should be pinkish, really. But if you have low blood pressure, drinking beet juice regularly may increase the risk of your pressures dropping too low. Monitor your blood pressure carefully. So I stated before that if you have normal blood pressure, it shouldn't reduce it. This is stating that it can. Okay, so just be cautious because everybody's more sensitive to other things, but if they're going, I'm going to go off of this. If that's what they're going off of, then I want to just keep everybody safe. Just keep track of your blood pressures just in case. If you're prone to calcium oxalate kidney stones, don't drink beet juice. Beets are high in oxalates, which are naturally occurring substances from crystals in your urine. They may lead to more kidney stones or kidney stones in general. All right, so let's go over some of these questions. Does any breathing techniques, exercise tips and tricks, please? Okay, Jane, I will do that. They make beetroot gummies. Do you think that would be the same as drinking beet juice? It's a good question, actually. I mean, if it's concentrated, which I'm assuming it is, I guess the gummies wouldn't be that bad. You know what I would do? It's a great, fantastic question. I would do a comparison. I would take a look at the ingredients in just beet juice and take a look at the ingredients as well as look at the calories, look at everything, because it shouldn't be, it shouldn't be that much of a difference. So I would look at the servings and what's in the serving size of a gummy in comparison with an actual just drinking beet juice. I would just look at a comparison. So I'd take the gummies, look at the back of the label, look at the label or the ingredients label, and I'll look at the ingredients label inside of beet juice, which is just beet juice, but it should go over some of the other things that's in it, and just look at a comparison on quantity. How much of a concentrated is it? Is it just as the same? Okay. Let's see, breathing techniques and exercises, tips and tricks, please. All right, Jane, I would say that one of the best things I can say about tips and tricks about breathing exercises is, the reason why it's very hard to find a lot of the exercises with pulmonary rehabilitation, because not everybody's symptoms are the same. Not everybody's symptoms are the same. Some people have heart complications with lung disease, and other people have something else with something else. So the rule of thumb is I would have to know what your complication is. So if you're just looking for breathing exercises, sure, I can give you something here. On a breathing exercise, an easy way of actually doing just on your starting of exercise is always, of course, going really slow. Okay, so here's one I'll go over with you. Everybody, let's go ahead and sit up straight. if you want to do this with me. Now remember, virtual pulmonary rehab, the ones that we do, is a telemedicine program. Okay, meaning I see you, you see me. I can critique your technique and therapy as you're in the program itself. Okay, but right now I can't see you, so I'm not sure if your technique is off, if it's good or not. If you're breathing shallow, if you're breathing deep, I have to see what's going on, really. Okay, so everyone sit up nice and straight. Okay, let's do a 1-to-1 ratio when it comes to breathing exercise or just walking and breathing. One step I take, I breathe in. One step I take, I breathe out. Okay, so let's take one step as you're seated. Okay, we're just gonna walk. We're kind of like walking seated in place, right? Okay, take one step. Go ahead, lift one leg and up. Yep, one leg and put it down. Inhale. Now, how deep do you fill up your lungs? How deep? Well, this is a full breath. Is when if I max out my breath, right? Okay, that's a full breath. I don't need a full breath when I have to do this. All I have to do is at least breathe in halfway. So if this is 100% fill, I know that's too excessive. But if I fill up my lungs at least halfway, but not bring in a quarter of that volume, I want to bring in half, you know. So if I bring in half, I have to just see some chest rise, where my chest is rising. If I'm breathing like this, it might be way too shallow. That might be good for sitting down doing nothing. But if you're going to stand up and exercise like you're about to walk, you want to breathe with the exercise, of course. And you want to put in some more air than that inside your body, more oxygen in your body. Let's take one step. Inhale. Halfway, don't breathe shallow. Pull in halfway. One step, exhale. One step, inhale. One step, exhale. One step, inhale. One step, exhale. Take another step, inhale. One step, exhale. Now, of course, you're not going to be very winded by sitting down doing these exercises. It's when you want to stand up and start walking. When you want to stand up and start walking and you're taking one step inhale, one step exhale, you know, it's a good idea. It's a very, very good idea to actually breathe with the exercise, of course, making sure you're filling up your lungs at least halfway. But the other thing is governing your work of breathing. That's the tough part. John, can you focus on here really quick, please? So let me kind of just bring this up a little bit here. Your work of breathing. This time I got over here. Okay, so let's say I'm back over here. All right. So this is 0, 1, 2, 3, 4, 5, 6, 7. You gotta get locked in place. Sorry, this was moving. 8, 9, 10. So 0 to 10. This is a Borg scale. Okay. This is like a breathing index, a dyspnea scale. So this is going to be the worst. This is going to be the easiest on breathing. Okay. This 0 is not considered the best. Easiest. Okay. This means I'm very happy. No problems breathing whatsoever. I'm at a 0. Okay. People think that being at a 0 on a work of breathing is good. Okay. No, it's not, actually. It just means that currently you're not feeling any work of breathing. Okay. But easier breathing and versus, I don't want to make it complicated, but let me put up a talk test above this. Okay, so the talk test is going to be in line with this. Okay. So 10, I wouldn't be able to say one word. 9, I wouldn't be able to say one word. A Borg scale of 8, I will only be able to say one word every breath. 7 would be 2. 6 would be 3. 5 would be 4. 4 would be 5. 3 would be 6, and so on and so forth. So basically, on a talk test, let's say somebody says, Alex, I'm at a 10. Well, how could they say, Alex, I'm at a 10 if on the Borg scale versus on in comparison with a talk test, they wouldn't be able to say one word. So that person can't be at a 10 because the person's vocalizing. If the person was literally at the 10, now mind you, their anxiety could be at a 10. So you're exercising with me, but you have to also understand the work of breathing. Some people feel that being at from a 0 to a 3 is good. Like they should never feel winded at all. Did that ever work when you were a kid? You know, that doesn't make any sense. Of course you're going to feel a little work of breathing as you're exercising, as you're running. That's normal. That doesn't mean something's wrong with your lungs, you know. So being at this level here is not necessarily a good thing. That's good like when you're sitting down resting, but not when you're exercising. If somebody was exercising with a Borg scale, an RPE, a rated perceived exertion, or a Borg scale or a talk test where they're talking more than 6+ words, then that person's not working hard enough, of course. They're not going to benefit from that exercise. It's not even increasing their heart rate. You want that to happen. You know, you want that to happen. So the worse work of breathing possible means the less likely I'm able to talk, okay? Now, if the person was like, well, Alex, I feel like I'm at a 10. I'm not sure if I'm at a 10. It's like, well, maybe your anxiety's at a 10. Because anxiety might make it feels like you're out of breath, you know, because your brain's consuming a heck of a lot of oxygen. And if your brain consumes, or an organ consumes a lot of oxygen, it's going to give off a lot of CO2. So, Borg scale versus the talk test. When you're walking, you're doing 1-step inhale, 1-step exhale, 1-step inhale. Fill up your lungs how deep? Halfway, right? 1-step exhale all the way. 1-step inhale, 1-step exhale. So let's say you're walking now with a proper breathing technique, and then you determine how out of breath you are. Understanding that just knows that I can either speed up, slow down, or just keep at the same pace. Let me demonstrate what I'm talking about. 1-step inhale, 1-step exhale. So as I'm walking, I feel my work of breathing going high, so I confirm with the talk test to see if I'm okay, right? Which Borg scale or RPE or talk test, which one would determine that I'm okay exercising, to continue the exercise, whatever the exercise is? 4, 5, and 6. That means being able to say 3 or more words. Specifically the 5, which I'm saying 4 words. Which magic 4 words do I like to use the most in my classes? Does anybody know? My breathing is manageable. Okay? So let's put this to a test. Because you're exercising, I want to make sure you're good with your exercise. Let's put this to a test. 1-step inhale, 1-step exhale. So I'm walking, okay? I do a quick talk test to do a self-assessment on myself. I check my pulse. My pulse feels like within range. Okay, my oxygen right now. How do I know my oxygen is okay? Well, am I dizzy? Is my vision getting blurry? Is my balance becoming off? Do I feel like I can't, like I don't feel hungry for air, but I feel like I can't catch my breath? Okay? So those types of symptoms are oxygen related. All right, I don't need a pulse ox to tell me what my oxygen is. As long as I am coherent, my balance is not off, my oxygen might be just fine. Okay, but of course, keep your pulse ox on to really confirm it if you want to, or if you're just not used to. Me as a clinician, I'm just kind of used to and understanding symptoms very, very, very well, that I can understand if my oxygen is low or not, if my CO2 is high or not. I can understand that just by looking at the person and actually just doing some easy assessments, you know, just objective assessments. So I'm walking and I'm just doing this. My breathing is manageable. How out of breath am I according to the Borg scale? Does anybody know? How out of breath? 8, because I'm only saying 1 word every time I have to breathe. My breathing is, you're saying 1 word every breath. Okay? Now, because I'm sure there's some people that probably thought, oh, you're at a 5. No. I said 1 word every breath, but I said my breathing is manageable. If I did it like this, my breathing is manageable. And then I have to initiate another breath because that's when I feel like it was triggered. meaning, you know, as I'm walking, the more words I can say, the better I'm off. Okay, the better off I am. So I'm taking one step, you know, one step inhale, one step exhale. I determine my work of breathing, so I do this. My breathing is manageable. Okay, where am I on my Borg scale? 5. Is that okay to keep going, or should I stop and slow down? My work of breathing is higher. Mind you, I'm feeling a little winded, but it's very manageable. Should I stop, or should I keep going? Keep going. Okay, you keep going. If you're between here, you're in a safe zone. 4, 5, and 6, you're in a safe zone. Okay, so let's do it like this now. I'm walking. I do. My breathing is manageable, so my breathing is okay. Where am I at on Borg scale? All the way down. All the way down, probably down at 0. Because I was able to say my breathing is manageable, so my breathing is okay. On top of that, I said almost more than 9 words. So technically speaking, yeah, my work of breathing is not even high, as you can well see. I can talk loquaciously, meaning I can talk a lot without having to gasp for air. Okay? So you're walking, and let's say you want to walk in place first. That's fine with me. Just take a chair, stand right behind it. One step inhale, one step exhale. Because the legs might be a little weak, you know, if your legs feel weak, like they are weak, they don't have a lot of muscle on them, you might want to strengthen them up. Doing things like a mini squat will actually be very beneficial. Of course, never use a chair that has wheels on it, okay, like this one, because as you're pushing on, it might slide out underneath of you. Make sure it's a sturdy chair that does not have wheels. But for the sake of argument, I'm just going to use this, just pretend it doesn't have wheels on it. So I'm going to keep my feet shoulder width apart, and when I go down, I'm going to breathe in. When I come up, I'm going to exhale. Now, I need it to be equivalent to stairs, okay? So on stair climbing, you don't go all the way down. What you do is you go down about 6 to 7 inches and then come up. So I'm going to go down, inhale, and then come up, exhale, all right? So here I go. Keep my feet shoulder width apart. Now, I'm anticipating the exercise I'm about to do might make me feel a little winded. What should I do? Rex, the 2 cups a day, it said 8 ounces, 8 to 9 ounces per day is all it said. So there's in a cup, there's usually, you know, there's 8, if it's an 8-ounce cup, then yeah, just 1 cup would be fine. Okay, for the beet juice. Let's see, 6, and COVID. Gotcha. Okay. All right. So I keep my feet shoulder width apart. I go down. Inhale. How deep do I fill up my lungs? Halfway. Remember that. Halfway. Come up. Exhale. Down. Inhale. Up. Exhale. If you don't want to use a chair, just simply put your hands on your waist. Okay. Keep feet shoulder width apart. Pursed lip breathe first. If you're anticipating, you might be a little winded. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. I did a self-assessment talk test. I just counted from 10. If I can say 10 numbers, you know, easily without having to feel like I'm struggling to breathe, then I know my breathing is okay. I go down, breathe in, up, exhale. Lenny, very good. Up, exhale. Down, inhale. 6, 7 inches. Don't go all the way down. 6, 7 inches. Go down, inhale, up, exhale. Down, breathe in. How deep do we fill up our lungs? Halfway. Remember that. Halfway. Up, we breathe out. Down, inhale. Pursed lip, breathe back up. Down, inhale. Up, exhale. Then continue on with walking in place. The timing that you should do, I kind of look at it as yoga. All right? In yoga, we don't count how long we hold a pose for. What we do is we use our breathing to determine the time. So in a yoga pose, let's say I was doing a tree. Now, I'm not a yoga practitioner at all. I just know a lot of yoga, but I'm not a practitioner with it, in a sense. Okay, I leave that to the professionals that do that for a living. Okay, so basically on a tree pose, I put one foot against my kneecap, and I do this, and I hold that position. As I breathe in, slow. Let's say I want to hold that position for 3 breaths. I'll breathe in slow, I'll breathe out slow, breathe in, breathe out, then again breathe in, breathe out, and that was 3 breaths. And then I'll transition from this pose to another pose where I might do a different yoga pose. So breathing with the exercise, I kind of look at it as almost like yoga, all right, where there's not really a timer, it's based off of your breathing, okay? Is this video one of your actual classes of your program? No, we're at telemed. Guys, can anybody see that? It's telemedicine. This is a telemedicine company. We do virtual pulmonary and cardiac rehabilitation. This is telemedicine. So, meaning where you have a device that has a camera, like a phone, like a cell phone, or a computer that has a camera on it, tablet, whatever, just one of those devices, and then you see us. You never did telemedicine with your doctor? It's like FaceTime in a sense, where you see me, I see you, but you're in a group setting with me, and we do therapy together. It's not pre-recorded. Okay, that's what telemedicine is. It's not a pre-recorded, it's in real time. It's not a pre-recorded thing. That's something we did a couple weeks ago. All right, so they're never pre-recorded. We do have Mind You Lungs, that's pre-recorded videos that people do on a self-paced thing, but not for telemedicine. Telemedicine can never be pre-recorded. It should never be pre-recorded. It should always be in real time, where at the same time, Eastern Standard Time, whatever, it should be in real time. Okay, like I'm talking to somebody right now, that's in real time, versus I record something like a message, send it to somebody, that's recorded. So telemedicine is never recorded, it's in real time. Okay. HRN has helped me in just 5 sessions with Mel. No problem, I think that's great. I completely lost my voice. Period, when I walk. Pulmonologists have no explanation, but I know it's related to my COPD. Have you information on others with COPD who this happens to? Yes, that's what we handle all the time. Mind you, I never say we deal with, because these are our patients, these are our guests, these are people that that are in a program, right? So you have something related to COPD, that's what we work on. People that have an increased work of breathing, people that have that complication where they have a lot of congestion, they may be on a trach collar with a trach, they might be a CPAP person, they might have sleep apnea, they might have to go through smoking cessation. It's not just COPD, but it's anybody with any type of lung disease and heart disease. And then you work out with us, but that's what the program is about. I wish I joined a long time ago. Everybody says that. A lot of people say that. I wish I knew about you guys a long time ago. Well, if you haven't started, then this is the best time to start, especially with the new year coming around, and all the, you want to make it a good year. So a lot of people tend to join at the end of the year for some reason, which is the worst thing you can always do, is just keep procrastinating and waiting. I would say if you're trying to join in to the program, and joining in the program is easy. You just call us up. Our phone number is 410-871-4601. You call us up. We schedule you in to see Dr. Shaw. We obtain your insurance information. Then we get back to you with really, this is a fast process. We get back to you with what your insurance is going to do and everything like that, so you're fully aware of everything. We can't blindside anybody, because that's not what we want. We want to make sure you understand what's going to be involved. So you'll know the whole layout before you start. And then you'll start, and you'll have an assigned clinician like me. A lot of people assign clinician. So then you'll be with me for a period of time. And then once I get your goals set, meaning I have your goals, you want to be able to come off oxygen, you want to be able to walk 1 mile before you have to sit and rest. So I work on those goals until you're at that goal. and then I transition you to advanced levels if you want to go to advanced level. Some people just want to, after they're done with the program, they want to just enjoy life, while some people want to continue the program for long term. That's called maintenance therapy, and everybody has the option of doing that. Okay, guys, that is it for pretty much today. Does anybody have any questions that I can help answer? I'll try to answer some of these. So I went over how you can join the program. All you have to do is just give us a call. That's it. You can even just go to our website at, it's actually on here too on the bottom, but it's cut out. But it's HRN therapy, I'm sorry, it's hrn.health. So you just type in on the user browser, HRN, period, and then just type in health, H-E-A-L-T-H, health, not help, health. So hrn.health, and then it will just show you how to get, get into the consultation itself. Remember, this is a certified program, so we, it's a medical program. Okay, so. My lung functions, see, what is lung function? My doctor said I have 30%. What can be done to improve that? So lung function is a type of measurement that we do. When we do a pulmonary function test, we determine through calculation what, how severe somebody's lung disease is. And then we do therapies like pulmonary rehab. We'll do therapies to strengthen up the lungs and increase the lung function score. And yes, that does increase. A lot of people thought that didn't increase, but it does, especially with HRN, it does. How can I start my entire lung? How can I start using my entire lung and not just the top part? What exercises should I do? All right. So you don't want to always use the whole entire lung, like both lung lobes. You want to be able to do it, like fill up both lungs fully, but you don't have to breathe that deep, okay? For smoke and cessation, you just have to, the next question on here is, I'm in HR and I wanted to know about the smoke and cessation program. For smoke and cessation, you just have to bring it up in class. If you bring it up in class, then your assigned clinician will work with you either in a small group or one-on-one with you, okay? So that, if you just started into the program, that's something they always have to go over. So they have to go over that. So you're probably just fairly new, and they just haven't gotten to that topic yet. With the topics we go over, about 1,700 exercise tips and topics. All combined together is about 1,700. Not a couple hundred, 1,700, 1,700, topics. So no worries. You're very welcome. You're very, very welcome. No worries. Oh, also starting a podcast. Right now, nothing is done yet, besides we just kind of started the initiation of it. But we're also starting a podcast and bringing in guests, also bringing in patients, and talking about the experiences with, with lung disease, with heart disease, and what they do to cope at home, and what they do on as far as exercises, and also talking to some of the highly respected clinicians will also be coming in to join in with the podcast, and especially with our live stream that we're doing now. But anyways, guys, you're very, very welcome. Anyways, have a great day. How important is CPAP and using oxygen with it? So CPAP is very important. BiPAP, CPAP is very important. I'll try to bring that up next time, but CPAP, BiPAP, these are non-invasive ventilators that help splint your airways open or help you breathe throughout the night. So if you didn't have that, remember I was bringing up pulmonary hypertension. And part of it, of developing pulmonary hypertension, can also be from the use from the diagnosis of sleep apnea, which a lot of people use CPAP to help with. So if you're not using that, it could get the pulmonary hypertension to get worse, as it's a progressive disease. Remember, guys, any progressive disease, if it's getting worse, it's getting worse. If you're improving, you can't be getting worse, okay, because you're improving. All you have to do to manage that progressive disease is keep improving. You know, keep improving, because if you're there's no third direction. If you're always improving, you can't be getting worse. You know, people that don't do anything about their situation usually gets worse, 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 worse until they pass away and die. You don't have to go out that way. If you're improving, you're not getting worse. It's just the way it is. Okay? So guys, improve yourself by getting into the program. Let me help you. And then let's get this down to it, man. See you guys. Bye-bye.